Welcome to Quick Facts in a Hurry with Sierra Luna and Pauline Dulang.
Hello, this is Sierra here with Quick Facts in a Hurry. Today, I would like to discuss the health gap in America. Going to the hospital is usually the first step someone takes when they fall ill or if they hurt themselves. Unfortunately, the healthcare system does not treat everyone the same as it may be expected. The health gap, or health inequality, can be defined as differences and are gaps in the quality of health and healthcare across racial, ethnic, and socioeconomic groups. The implication of this issue on society is that there is a high possibility that someone will be treated differently by the healthcare system if they are a minority or if they fall under the poverty line. Several studies that have been conducted have highlighted this issue, and a report published by the Institute of Medicine titled Unequal Treatment, Confronting Racial and Ethnic Disparities in Healthcare, reviewed several articles regarding the matter. The IOM analysis revealed even more objective evidence of major differences and raised the specter of the role of bias and discrimination with regard to populations with equal access to healthcare. Racial inequities in our healthcare system are therefore very prevalent, since this report overlooked about 600 articles. This means there is a huge drawback for minorities when it comes to seeking out professional healthcare. As one article notes, the reason race is such a contributing factor to the health gap is because their perspective of the causes recognizes that advantage and disadvantages are, in the USA, closely linked to race, largely because of widespread and institutional discrimination. This article also observes how segregation related to discrimination contributes to levels of poverty. One is lucky to be born into a neighborhood where a majority of students have a better chance at seeking a higher education or even to graduate from high school. So, while poverty is a contributing factor in the health gap, race and discrimination seems to be an even bigger factor. Not only is it more likely that you would be below the poverty line if you are a minority, but mortality rates in hospitals are higher for minority groups. This issue is actually quite significant. Infant mortality for Black babies remains nearly 2.5 times higher than for white babies. The life expectancy for Black men and women remains at nearly 1 decade fewer years of life compared with their white counterparts. Diabetes rates are more than 30% higher among Native Americans and Latinos than among whites. Rates of death attributed to heart disease, stroke, and prostate and breast cancers remain much higher in Black populations, and minorities remain grossly underrepresented in the health professions workforce relative to their proportions in the population. This has been Sierra here with Quick Facts in a Hurry. Have a great day.
Thank you for tuning in to Quick Facts in a Hurry. If you'd like to make suggestions, email us at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.